Hi everybody, hi. Welcome to Previous Shortcuts. My name is Marvin. I'm the clinical lead of Previous Shortcuts. People ask me, Marvin, what do you do? It's simple. What I do is I make revising fun. I take all the complex things and I make them easy for you. I take clinical knowledge and I make it so easy, so absorbable, so much fun to understand. And one of the places that everyone's been asking me to do a video for is chapter 7. The reason I'm doing chapter 7 today of the BNF, of your BNF, is because my private group is starting off the revision with chapter 7. So what I'm going to do for you today, guys, I'm going to take the genito-urinary system, which many people struggle with, and I'm going to make it so easy for you to understand. So let's get started. The genito-urinary system. Today we'll be talking about things like your bladder. We'll be talking about urinary retention. We'll be talking about urinary incontinence. So very exciting, people. I'm excited. Are you excited? Hit that like button if you're excited. So today with Marvin, we will be doing your genito-urinary system. Ladies and gentlemen, let's go. So I'm so bad in terms of my artistic skills, but I'm going to make an attempt. So let's draw a few structures. So the first thing we're going to draw is your kidneys. Yes, I know they don't look like kidneys, but you get the point. So we're going to got 2 kidneys. So what happens in your kidneys? Let's make this so easy. Let's make this so much fun. Your kidneys, what happens? You produce urine, right? So urine is produced in your kidneys. Let's look at how a normal functioning kidney works. Then we can look at what happens to a kidney that has got a disorder, okay? So this is a normal kidney, right? So you've got your normal kidney. So what happens is they produce urine. So what happens with the urine? The urine has to go to somewhere. So that goes down through what we call your urethra. Your ureter, that goes into ureter. And the ureter takes it all the way down to a massive bladder. Okay, so that's your bladder. Sorry, I know my artistic skills are poor, but you get the gist. So I'm going to make this so easy. This is an example of your genito-urinary system. Urine is produced over there. Urine flows and it comes into your bladder. There are a few important things I want you to look up for now in terms of your learning, right? So the first thing I want you to know about the structure is this. The first thing I'm going to draw is this over here. So what is this? Why am I drawing this? I'm drawing this because in your bladder has smooth muscle. Your bladder has smooth muscles all over it. It's so important that you know this, and I'm going to tell you why. Why are we looking at smooth muscles? Because smooth muscles are very important in terms of locking or opening your valves. So we have what we call, I'm going to use a different colored pen. Let's go for green. We're going to draw them green. So here you've got a muscle at the entry of your urethra. So that's what we call your urethra. So I'll just do that green, but you know, it's not a muscle. Okay, that's your urethra. That's where urine flows. These are muscles over here. These muscles are like valves. They call sphincters. They open and they shut. So they control the flow of this urine. So we're going to fill this up with some urine. Let's go for orange urine. So you got some orange urine. So this is your urine over here in your bladder. Another important feature I want you to learn is you've got a structure here. I don't have enough colors, but I'm going to draw this. So this is your prostate. So say prostate. We've got smooth muscle in your bladder. Smooth. I'll just put that's your bladder. That's your prostate. These are what you call your sphincter muscles, internal ones. And you've got some external ones around here as well. Very, very important that you look at this. These are very important features, ladies and gents. This will make complete sense very soon. Underneath these muscles, you have what we call, that's another muscle. And this muscle is what we call your pelvic floor muscles. Okay? And all they do is they hold up these muscles. So they help these muscles to shut. All right, so very important you understand this. So in a normal functioning urinary system, You also have to be very, very aware of this organ over here, which is your brain. Doesn't look like the brain, but that's your brain and your spinal cord. So what happens when your bladder gets full? I've got so many pens and they keep falling over. Okay, so what do you think happens when this gets full? So when this gets full, something happens. When this gets full, you've got what we call stretch receptors in the smooth muscle of your bladder. They're going to send a message to your brain saying, hey, the bladder is full, we need to get some urine out. The brain is going to send that message back, and that's going to cause a contraction of the smooth muscle. That's why I said it's so important to know about the smooth muscles. What will happen if your smooth muscles contract? What do you think is going to happen? What do you think is going to happen? When this contracts, this is going to cause your sphincter muscles to open up. So contraction causes these muscles to open up. So contraction of the smooth muscle, so it's like that contracts and the bottom opens. So what's going to happen when this opens? Then you have the flow of urine. That's in a nutshell how a normal functioning urinary system is going to work. This gets full, this sends a message, the message back, contraction, opens up, boom. There you go. That's how it works. So now what we're going to focus on is we're going to focus on when you have a problem. What could we have? So the two main types of problems that we can have. The first problem is we cannot control our urine. It just leaks involuntarily. Okay. So the first one is we cannot control our urine, and this is what we call incontinence. So I'll put this incontinence. And then the second thing we may have is we cannot pass our urine. It is stuck. It is retained. And we're trying to get urine out, but we can't. That's what we call, number two, retention. So the main two things that you need to focus on when it comes to the genito-urinary system is urinary incontinence and urinary retention. So let's talk about the first one, urinary incontinence. What do you think could possibly happen that could cause you to pass urine without being able to control it? So there are many factors. So we can look at things like aging. So perhaps you may just get old, like myself. So when you get older, what happens to your muscles? What do you think happens to muscles when you get old as you age? What happens to muscles? Muscles get weaker. So one of the first causes that we may have with incontinence is if these muscles get weak. That's why I said to you, it's so important you learn these muscles. If these muscles get weak with age, what happens is they become relaxed. What happens when they relax? They open up. And when they open up, what happens? Orange comes out, your urine. So the first thing we need to watch out for is this, your sphincter muscles. We need to keep them in check in order to stop incontinence. What else do you think can happen? We said earlier that when this contracts, the contraction of this causes this to open. So anything that's going to cause contractions, that's going to make these muscles contract, has a high chance of causing what? Incontinence. So what sort of things do you think could make this happen? So if you have a problem with your central nervous system, perhaps your brain is sending so many signals for it to contract. Normally this contraction should happen when your bladder is full with the stretch receptors. If a bladder doesn't function properly, you can have a situation where this isn't full, but then messages start coming from your brain to say, hey, the bladder is full. And so this makes your muscles contract. So this is what we call an overactive bladder. When your bladder is so active because of messages from your brain, it keeps contracting, and what happens is keep passing out urine. So the problem could be from there, could be from your CNS, right? And any condition that could affect the CNS, Parkinson's and different things could cause incontinence. So another incontinence to talk about is to do with these muscles over here. Your pelvic floor muscles normally hold these muscles together. So if you've got strong pelvic floor muscles, if these are strong, you're doing your pelvic floor exercises, will make these muscles hold up, and so you wouldn't pass out urine because it holds that muscle in place. So if anything happens, say for instance you have a damage to your pelvis or you have some sort of accident, then this could affect your pelvic floor muscles. If this gets weak, incontinence. So this is very important that you learn this. Another type of incontinence that could affect these muscles that's very common is what we call stress. I'll put this stress incontinence. So with stress incontinence, little things like sneezing or coughing could make your urine flow out, okay? So it normally happens with people that have weak pelvic floor muscles, or if you have your sphincter muscles are weak, just sneezing or coughing could literally make that open up and urine is going to pass out. So these are different ways that we look at incontinence, things that could cause activity, contraction, things that could affect these muscles, things that could affect the muscle, all of these things that could affect your brain, conditions that could affect your brain. I don't know other things like UTI, there's so many conditions and so many circumstances, even drugs like diuretics. So we can talk about the brain, we got to talk about diuretics, make you pass urine. So there are many factors that could cause incontinence. But that's literally how you need to understand the cause of it. So why are we trying to do this? Why do we need to understand this? Why, ladies and gents? It's because if we know the cause, then we can think about the solution. So the first thing I want to focus on is, what do we want to do? The first thing we want to do is stop the contraction of this bladder. Why? Because if we can stop this bladder from contracting, guess what's going to happen? This is not going to open. Guess what's going to happen? You'll be able to retain more urine, and that's going to help reduce incontinence. So what do we use, ladies and gents? What can we give you here that can help to stop this from contracting and contracting? We give a drugs called antimuscarinics. Okay, so antimuscarinics. So antimuscarinics examples, I'll give you DOTS. So good mnemonic for you to remember is DOTS, right? And this stands for darifenacin, oxybutynin, tolterodine, solifenacin. These are your antimuscarinics. These are the drugs that are going to prevent this from contracting, so they're going to help you with incontinence. If these don't work, you give them an M, mirabegron. Does that make sense, ladies and gents? So I really want you to understand this. So antimuscarinics are going to stop this from contracting, and by stopping this from contracting, this is not going to open. Then will help you to retain more urine, and that prevents incontinence. So what else can we do? What else can we do? We'll give another drug that could stop this from contracting. All examples of antimuscarinics, so your main antimuscarinics there. But other ones we could also give TCAs. TCAs, examples of TCAs, imipramine, right? Like your tricyc antidepressants. So we could give you imipramine, for example, that helps as well. That could help prevent contraction, and so that could be used to help you retention with incontinence. Another thing we could do here is we go to the source. Here, we could give you something called antidiuretic hormone. So an antidiuretic hormone is going to stop you from losing urine. So that's what it does. Antidiuretic, it stops diuresis. So it stops you leaking out urine. So examples of an antidiuretic hormone is desmopressin. Desmopressin. So I really want you to watch this and see that things work in different parts of your body. We have this work in the brain. We have spinal cord, which I'm going to talk about very soon. But we've got desmopressin. What's one of the most important things you need to learn about desmopressin? One of the important side effects is hyponatremia. So what this drug does is it stops you from passing out urine, but then you have a risk of having too much water in your system. What happens when you have too much water in your system? What's going to happen to your salts? They get diluted. So you have hyponatremia. So with these sort of patients on desmopressin, you really want to avoid them consuming too much fluids, right? Too much fluids. Normally we would say about 1 hour before taking the medication and then about 8 hours after taking the medication, because you don't want them to suffer from hyponatremia. Because if you've got hyponatremia, guess what you're going to get? You're going to get what we call the 3 C's, potentially. The 3 C's are your convulsions. You can have convulsion. You can get into a coma. Very important. Convulsions, comas, or confusion. You get confused. So the 3 C's: convulsions, coma, confusion. That's what will happen if you drink a lot of water. For instance, kids swimming when on desmopressin. So you give this to kids, especially at night, to prevent them from passing out urine, which is called nocturia. So nocturnal enuresis, right? Passing out urine or bedwetting at night. So it's very important you understand this. Is this clear? Is this making sense? I want to take my time just to make you understand this. So we have another drug that works more on your central nervous system. An example is duloxetine. It's very important I mention this medication, duloxetine. So with duloxetine, it's normally given to women after they've tried some pelvic floor exercises. So I'm going to put this here. So after doing this, if that doesn't help to improve, to stop that incontinence, then you could give some duloxetine. Sorry, there is an N there. Duloxetine. Great. So this is just an example trying to show you how the system works and showing you how we can literally deal with incontinence, right? So make this muscle stronger. Stop this from contracting. We've seen the drugs that can do that. Stop your antidiuretic hormone from the brain so that doesn't make your urine pass out. We could give some duloxetine, and this helps a lot in what we call stress incontinence, okay? Stress incontinence, like I mentioned earlier, is when you pass out urine simply by coughing. It's normally due to weak muscles. So we could strengthen them. So there we go. That's how, is that making sense? People are making this easy. So we've dealt with incontinence. Now let's talk about retention. So with retention, you literally have so much urine and you're struggling to pass the urine out. So either you cannot pass urine out at all, or you only pass out little bits of urine. So the different things we can do. What do you think we can do? So what could be the causes of this? What could be the causes of retention? Again, there are many causes of retention. You could have a blockage, maybe some stone or somewhere, and you might have to dissolve the stone, or you could do a little surgery. You could have a stone there, preventing the flow of urine. Another thing you could have, which is the most common one in men, the cause of urinary retention. The most common cause, I'm going to write this with my blue pen, because it's that important. The most common cause is due to this organ here, your prostate. It's what we call BPH, benign prostatic hyperplasia. So if the prostate grows bigger, I'm going to make that bigger. The bigger this grows, if this goes bigger and bigger and bigger, what do you think is going to happen? What do you think is going to happen? What's going to happen is it's going to press against your urethra, so this will get smaller. So as this gets bigger, this gets smaller. So you're going to struggle to pass urine out. Okay, so that could be one of the causes. That's the most common cause of urinary retention in men. Okay, BPH, enlargement of the prostate. So what do you think causes the enlargement of your prostate? Now, what causes this is testosterone. Testosterone converted to dihydrotestosterone. I'm going to call it DHT. So what makes this big is this testosterone converts to DHT, and DHT then causes this to grow big, enlarges your prostate. Okay, testosterone, DHT, prostate enlargement. I'm showing this because once we get into the treatment, you understand better what we can use. So these are things that are going to cause retention. So let's see how we can treat retention. So what we're trying to do with retention is we're trying to open these valves. So one of the first things that we can do, to help, we said earlier that when this contracts, your smooth muscles, when this contracts, this makes urine flow. The reverse is true, right? So if this relaxes, if we keep this relaxed, then what do you think that's going to happen? Urine is not going to flow. So with retention, we want to keep this relaxed. And we give drugs to help them relax called alpha blockers. That's going to keep this relaxed. Okay, that's going to keep this relaxed so you don't have any contractions. So your alpha blockers. Examples are drugs like the N-zosine, doxazosine, alpha-zosine, those zosines, okay? These are alpha blockers. One of the most common side effects with them is hypo. These medications are so important. They can make you very dizzy. They could make you very drowsy. They could cause diarrhea. So your alpha blockers are very, very important, right? They cause hypotension. Okay, they will cause hypotension. All right, they could cause syncope. They could make you faint. So very important you learned about your alpha blockers. So your alpha blockers, by giving alpha blockers, we're going to prevent muscle contraction, and by preventing muscle contraction, then we can retain urine better. So what else can we do? Another thing we can do is we could try to stop your prostate from growing bigger, because we know that when this grows bigger, this makes your urethra shrink, okay? It makes it go smaller. So we don't want this to grow big. So what can we do to stop this from growing big? The different things we can do. One of the things we could possibly do is we could do a surgery. So we can have a prostate surgery to reduce this, okay? We can have a surgery to reduce this so that then more urine is going to flow. Another thing we could do is we could give you a drug that could stop this from happening. We could give you a drug that could stop this from happening, because if we stop testosterone from changing to dihydrotestosterone, we said earlier this causes your prostate to grow big. So what we could do is we could give you a drug that will stop this from being made. So what drug do you think that is? Right? So the enzyme that causes this change is called 5-alpha reductase. 5-alpha reductase converts this to this, which causes an enlargement of that. So what we want to do is give you a drug that is going to stop this. That drug is called, or that group of drugs, the 5-alpha reductase inhibitors. 5-alpha reductase inhibitors they're going to stop this from growing. In that case, they're going to help with retention. So we need to know some examples. Some examples are finasteride and dutasteride. These drugs have a very, very important MHRA warning, because they're very important drugs. The side effects, you have to be very, very careful with the side effects. They could make you suicidal, especially the 1 milligram of finasteride for male baldness, for alopecia. So they could make you suicidal, very dangerous. Another thing they could do is they could cause breast cancer. So if you see changes in your breast, maybe enlargement, or maybe some fluids or some lumps, then you need to stop those medications, okay? It will cause breast cancer. Another thing is these drugs are very teratogenic. So we don't want to expose them to any women of childbearing age. Okay, so you want to avoid any tablets, avoid them getting in contact with tablets or any crushed tablets or any liquids from capsules from these drugs. So important, so important. Is this making sense? Are you guys still with me? Are you enjoying this? So definitely want to use it. So we're going to use alpha reductase inhibitors. Example, these drugs, they're going to stop this from converting to this. Then that's going to stop this from growing. And if we stop this from growing, the urethra tends to be bigger. And if it's bigger, then you might have more urine flow. So that's preventing urinary retention. So you got acute retention, which is very urgent, and you've got chronic retention. If you've got acute retention, then you could do things like, if you cannot pass urine at all, then another thing we could do is we could insert a catheter. So catheterization. We could insert a catheter, and that's going to help us get some of this urine out. So that's another way we can deal with retention. So ladies and gents, that's pretty much it. So in a nutshell, I've just gone through with you how the genito-urinary system works. I've shown you incontinence, and we have retention, which are the two main ones you need to know. I've shown you the most important parts for you to learn. This is your ureter, by the way. So urine is produced there, goes in through your ureter into your bladder. Once your bladder is full, stress receptors send a message to your brain. Then your brain causes your smooth muscles to contract. Once that contracts, your sphincter muscles here open up. And when they open up, urine flows out. If a bladder doesn't function properly, you could probably get overreactivity or overactivity of the smooth muscles where they're contracting so much that's causing a lot of urine frequency. Or you could get different things. You could have a situation where your muscles are very weak. With age, for example, things like pelvic floor exercise are going to help to strengthen them. We've looked at BPH. We've seen that when your prostate grows, especially for urinary retention, we can stop that by giving you 5-alpha reductase, such as finasteride, dutasteride. We've looked on here antimuscarinics, DOTS examples. We've also looked at mirabegron. We said TCAs. We could give those imipramine that could help. for incontinence, and we've spoken about duloxetine for stress incontinence. So in a nutshell, that's it. We spoke about alpha blockers and how they help to relax those muscles. So these are the examples. This genito-urinary system, chapter 7 of your BNF. All you have to do is watch this video. I hope this helps. We're here to help you. Always here. I love clinical, I love teaching, I love doing stuff like this. So make sure you follow us, Pre-Rest Shortcuts. Go to the Visa website, subscribe to our channel, and thank you so much. If you enjoyed this video, if you loved it, hit the like button, share the love, share the video. Marvin will appreciate. Once again, Pre-Rest Shortcuts, making revision fun. See you soon.